for the QC COVID-19 press briefing. Today is Thursday, November 5th. With us today, we have Nita Ludwig, Administrator with the Rock Island County Health Department, along with Edward Rivers, Director of the Scott County Health Department. And today we are joined by our local hospital systems. We have Robert J. Erickson, President and CEO of UnityPoint Health Trinity, as well as Doug Cropper, President and CEO of Genesis Health Systems. Both health departments have some prepared information as well as our latest COVID-19 data on cases for you. And then additionally, we will hear some prepared statements for our hospital systems who will talk to us about the uphill challenges that they're experiencing now, along with the stress on their resources as well as their frontline workers. Please get us started, Nita, with your data as well as some information you would like to share.
Thank you, Brooke. Today, unfortunately, we are reporting 2 additional deaths from COVID-19 in Rock Island County, and our deepest sympathies go to the family and friends of these individuals. A woman who was in her 70s who had been hospitalized, and a man in his 90s who had also been hospitalized. Our total deaths in Rock Island County now stand at 108 individuals. We also are reporting 149 new cases of positive COVID-19 in Rock Island County for a total of 5,089 cases of COVID-19. As you know by now, all the restaurants and bars in Illinois are closed for inside dining because of the spiking COVID-19 numbers. The entire state has entered into mitigation measures under the Restore Illinois plan by Governor Pritzker. We understand how frustrating this is for business owners and patrons, but with all the decisions within the state's plan, there is scientific reason behind it. A recent CDC study showed adults with positive COVID-19 tests were about twice as likely to have dined in a restaurant as to those adults with a negative test. The reason for this is simple. When you're eating and drinking, of course, you take off your mask. We know that masks dramatically reduce the transmission of COVID-19. We also know that the virus transmits more readily indoors than outside, which is why outside dining is still allowed under the state's plan. Some establishments are getting creative as the weather is becoming colder. Rock Island County and all of Region 2 could come out of mitigation measures on November 18th if metrics improve. Until then, please remember that our local businesses need your help. Getting takeout or delivery from these places could be the lifeline they need while still reducing your chances of contracting the virus. Thank you, and now I will give it over to Ed Rivers.
Today in Scott County, the Iowa Department of Public Health reports that we have 5,755 confirmed cases, and our deaths are at 51. Since our last briefing on Thursday, October 29th, the Iowa Department of Public Health reported 8 COVID-19 deaths of Scott County residents, 5 older adults aged 61 to 80, and 3 elderly adults greater than 80 years of age. Our heartfelt sympathies go to the family and friends of these members of our community. We're increasingly concerned as more people in our community die as a result of this virus. Scott County's dangerously high daily counts will cause even more deaths in the upcoming days and weeks. In addition to a high number of deaths and a flood of positive cases in the last week, with some daily totals topping 160 cases, the 14-day average positivity rate for Scott County has increased to 16.7%. This number is important not just for the general public in understanding COVID-19 response, but for our school districts. Many in our community have expressed concern and contacted us to ask what this means for the schools. School districts in Iowa are required to comply with Iowa's Return to Learn plan. The Return to Learn program does not require schools to move to remote learning when positive rates hit high levels. It also does not automatically authorize schools to move to remote learning when positivity rates increase. Once a county reaches a 14-day average positivity rate of 15% or higher, school districts may request to move to online schooling for a 14-day period. The decision is made independently by each school district whether to apply for remote learning authorization, and this is submitted to the Iowa Department of Public Education and the Department of Public Health. School districts make these decisions based on the experience in their school district and data from the local health department. Questions regarding whether an exemption will be sought should be directed to your district's administration. Should a school district decide to make an application, the request will be based on the average positivity rate in Scott County during the last 14 days and the percentage of absenteeism that exists in a school building and or school district. The application will be reviewed by the Iowa Departments of Education and Public Health and approved or denied based on these factors. Our increasing concern for the rapid increase in positivity we're experiencing in our communities is shared by our local health systems. We're joined by the Chief Executive Officer of Genesis Health System and UnityPoint Health Trinity, who will share the significantly increasing challenges their hospitals are facing.
First, we will hear from Bob Erickson, President and CEO of UnityPoint Health Trinity. Please go ahead.
Thank you, and good afternoon. We in our organization have talked about the pandemic and our response to it and our ability to coexist and treat with it is a marathon, not a sprint. And I don't know if we're halfway through that marathon or not, but I do know this: we've entered a phase that is the most difficult. And it's akin to entering the steepest part where we are going uphill, because I can tell you all of our numbers are going in the wrong direction. So the UnityPoint Health System is here to take care of our communities. And I'm going to share with you a couple of key indicators and statistics that we look at that we feel we're in a part of our journey that is threatening our ability to adequately take care of our community in the way we would like to. Because of resources and the number of COVID patients that we have. So a couple things we look at, and I'll share with you just at a high level. Each and every day over the last week to 2 weeks, we've hit a new high number of patients in our hospital that are suffering from COVID-19. Last week we were averaging, or 2 weeks ago, I'm sorry, we were averaging about 25 patients. Last week it was in the 30s. Today, where we sit, we have 48 patients that have COVID-19 within our hospitals in the Quad Cities and Muscatine. Out of that, 19 are in our ICUs. There was a point this week where in our medical ICU in Rock Island, every bed was full with a COVID patient and all but one were on a ventilator. We've gone from week over week. Last week, we were averaging 2.4 patients a day being admitted for COVID to today we're at 6. And that's a running 7-day average. So this isn't just increased spread in the community, it's resulting in increased hospitalizations and with people of all ages and people who are very, very sick. We also know from our experience that when a patient is hospitalized with COVID-19, although the mortality rates come down a bit, we're still running at about a 9 to 10% mortality rate when people are hospitalized with COVID. So it's a dangerous disease that some people are impacted significantly, including loss of life. The second thing we look at is the number of patients and the positivity rate out in our clinics that are being referred with symptoms, and we suspect COVID, and then we do the test. In the month of October, our average was a 20% positivity rate, and that was skewed heavily by the end of the month. Our last 7-day rolling average of positivity rate of patients coming into our clinics is 30%. The last 2 days, it's been 37%. So it tells you the community spread is wide. Now, on top of that, we're seeing many more patients being referred. So we've gone from maybe doing 85 tests a day in October, early October, to yesterday we did 400. And our last 7-day average is we're averaging almost 300 tests a day. Where that becomes concerning from a healthcare system perspective is a percentage of those patients, maybe 8 to 10%, will be hospitalized. And so if you think about 150 to 200 positive tests a day, that's just for us. I know Doug will share with you, their numbers are more than that. that could be 10 to 15 patients a day that need to be admitted to the hospital. Our ICU beds are full. We're going into our surge plan, and that's how you stress the healthcare system. We also look at our own staff, and we've seen increased number of staff that have tested positive or are home quarantining awaiting a test. And when we trace it back, it's not to our hospital or clinics, they're picking it up in the community. So another byproduct of community spread is the impact on healthcare workers when we need them more than ever to take care of our communities, not just in our hospitals, but in our long-term care facilities, in our clinics. When we have sick people and sick staff, they've got to be quarantined if they're positive for COVID. And that also impacts our ability to take care of the community and continue to surge our capabilities upward. The other component that we look at is, and I really appreciate the camaraderie and collaboration with Doug, is we've been reaching out throughout our region, whether it's the University of Iowa, Mercy One, OSF, all of our critical access hospitals, and we are touching base weekly, and everybody is in the same situation. They're seeing increased hospitalizations. They're seeing their hospitals basically full, and they are seeing positivity rates in their testing continue to increase, which the lagging indicator of those positive tests are hospitalizations, extreme sickness, and death. So we're concerned we're entering a stretch in the next couple of weeks that is really going to stretch and stress our healthcare systems. And so we're asking our communities to continue to work with us to do the right thing. This is a infectious virus. Wearing masks, social distancing helps prevent the spread. It doesn't cure it. People are going to get infected, but we really need to try to contain the outbreak and the spread so that we can adequately care, not just for our COVID patients, but for all of our patients. We still have people coming in with trauma, heart attacks, cancer, strokes, whatever it might be. And we want to be able to be there to take care of everybody. We're also entering into the very early end of our influenza season. We're really hoping that all of the mitigation efforts to help prevent COVID will help prevent the flu, but that's not a guarantee. And so they use the same type of resources that we do with COVID. So I ask on behalf of our community, our loved ones, our healthcare workers, that we work together. We're vigilant in masking, social distancing, avoiding large crowds, washing our hands, and working together to keep this under control so that we can coexist with this virus, as well as every other aspect of health and wellness in our community.
Thank you so much. Next, we will hear from Doug Cropper with Genesis Health System. Please go ahead, Doug.
Good afternoon, everyone, and thank you for the opportunity to talk directly with the media. I would just say that Bob did a nice job of covering the challenges at UnityPoint, and we have exactly the same concerns and challenges. Our numbers are just a little bit higher than Bob's. You know, November, believe it or not, is our 9th month in dealing with COVID. We started this off in March, and here we are in November. This is a marathon, just like Bob said, and you know, COVID fatigue is all too real, and it's certainly real for the community. I think we all are worn down and tired by the implications of the virus. In addition to that, our frontline staff caring for COVID patients and our general patients every day, day in and day out, are also feeling the fatigue of long hours spent with patient care, and we continue to ask a great deal of them. Bob described the situation. We're seeing a significant surge in COVID-19 patients, and it's really focused on our geographic area here. If you look at the map, it starts off in Wisconsin, it comes down south through Iowa and through Illinois, and it's really this particular area where the COVID-19 surge is hitting us the hardest. Nationally, we're also seeing, if you look at the national numbers, it's very clear we're in a third wave. The only question is, we don't know how high the peak is on that wave, and we're certainly seeing, just like Bob said, every single day, we're seeing an increase in the number of positive tests, in the number of patients that are admitted. We would all like to have our pre-COVID life back as soon as possible, but that's just not realistic. And we need to do everything we can as a community to come together to slow the spread of the vaccine. Let me just talk about 3 very specific concerns that we have at Genesis that we'd like to highlight to give a little bit more detail on this. The first is our trend in hospitalization numbers. Over the past 2 weeks, our inpatient numbers have been in the 40s and 50s, and that's a significant increase from the 20s and 30s. And just today, we set a new record of 56 positive patients and 7 PUIs that we held in our emergency department. That's 63 COVID patients. Our previous record for the hospital census was 51. So we jumped, 51 was on Sunday. We jumped from 51 up to 63 today. This puts a tremendous strain on our healthcare system. Second concern, the positivity rate for symptomatic patients has been very high. It's interesting, Illinois and Bob's numbers have always run higher than our Genesis numbers, but we are now into the 30s. On November 1st, our positivity rate was 31%, and we're running a 7-day rate of about 23%. The third concern is the number of symptomatic tests that we're doing. We are ordering more tests, and when you multiply the more tests times the rate, you're getting more people who have COVID-19 positive, over 100 a day for us. So on Monday, we tested 696 patients, almost 700 patients for COVID-19. Some of those were procedural tests, most were symptomatic tests. That's the highest number we've ever done by far. So if you wonder if COVID-19 is surging in our area, it is surging like we've not seen up until this point in time, since March. Staff capabilities are a challenge. Everyone wants to talk with us about beds and bed availability. Beds is not the issue. It's how many beds can we staff and what are our staff capabilities. And Bob talked about that from the standpoint of being stressed in 2 ways, and I would just emphasize that. The first way is we have more patients, many more patients, and we've gone to doubling up on our COVID floor to be able to handle all of our COVID medical patients, which is not something we've done, but we've gotten innovative and creative, which helps us staff that unit a little bit easier. And we've also seen, unfortunately, like Bob said, an increase in the number of employees that have come down with COVID-19. It took us 4 months to hit 25 positive cases amongst our employee group, and we've had over 70 in just the last 2 weeks, 16 of those being nurses. So we've reminded our employees to be careful and vigilant because they're not catching it at work caring for patients, they're catching it at work in break rooms and while they're eating, and almost all of them are catching it at home or in their personal life with community spread. Now, everybody wants to know what adjustments we've made and whether we've had to go back to April when we nationally in the United States discontinued doing elective procedures. We're handling this right now on a day-to-day basis, and every day we are making adjustments to both elective procedures and to reassigning staff to manage this so that we can help out those areas that are understaffed and are caring for COVID-19 patients. So right now, those adjustments are being made every single day. Just last week, we had to send out a number of open heart emergency cases to other facilities like the University of Iowa because we didn't have any ICU beds available. And so we always have to have an ICU bed after an open heart case. And that wasn't the case, and so we needed to make adjustments. So now let me make my plea. We need help from you, from the public. Please help out our caregivers. We need you to care for the caregivers. These are our family. They are my family and my loved ones. We consider them to be a family here at Genesis, and we need your help. And how can you help us? Well, you can help us by masking, by social distancing, by avoiding large gatherings, by washing your hands and staying home when you're sick. We need to see the COVID-19 rates go down in our community rather than go up, continue to go up. And like Bob said, they're just going up, up, up. Every day is a new record, including today, both in hospitalization and in positive cases. Now, the mayor of Sioux Falls, South Dakota said something that I think is helpful, and that was behave as if you have COVID-19 and take appropriate behavioral actions as if that were the case. So if I know I have COVID-19 and yet I'm not sick and I'm not home or I'm not in the hospital, I'm going to take a lot of precautions. I'm not going to go out. I'm going to have somebody else grocery shop for me, or I'm going to be very careful if I do, and I'm always going to wear a mask. I'm not going to be around any kind of crowds. I'm going to limit my interaction with just my immediate family. So think through, if that was the case, if you had COVID-19, how would you act? And we need to do that as a community to stop this and turn this around. We don't want, well, let me say it a different way. We're here to care for the community as Genesis Health System and as UnityPoint Trinity. We want to be able to do that. We want to be able to care for all the strokes and all the heart attacks and all the other things that happen every single day. And in order to do that well, we have to have all of our capabilities and not reassign them to care for COVID patients. And that is where we're at. We are being pushed to the maximum, and we don't want to go back to what we had to do in April. So please, please help us care for the caregivers and care for the community by making these adjustments that we've talked about of masking, social distancing, washing your hands, and not being in large crowds. Thank you very much.
Thank you both. I'm going to go into the chat here. As I typed in, we do have to conclude by 4 p.m. today. So we'll see if there's any questions that have not yet been answered and try to get to them before we need to sign off. The first question was related to some of the elective surgery postponements, which I think you both addressed. So I think that question was answered there. And then we did have a little bit of clarification about the I think Bob put it in there on the mortality rate of those patients that with COVID that are hospitalized. We do have a question here. I'll start with Doug for this one, and then we'll go to the next question for Bob. We've been hearing that so many people are unable to get tests through the community, either Test Iowa or other clinics such as, or CVS types of pharmacies. What impact has this had on the hospital's ability and demand for testing? Perhaps you can expand on what you were discussing with the large testing numbers you're seeing.
We can still do more tests. You know, people come, they contact our physicians. If they don't have a physician, they come into one of our convenient care locations, preferably, or to the emergency department, which isn't preferred. We are still handling the tests. It just means we have to send more out. Our internal capability is between 200 and 300 that we can do here. When we have 700 tests or so, we just send those out to LabCorp. Theoretically, you know, we could have an infinite number of people that we test. What it does is it just slows down the turnaround time. And unfortunately, the LabCorp facility we use in Kansas City is now out to, you know, 3 days rather than 2 days. And so that's the challenge. The quickest turnaround time we have is our internal testing. We use that for our priority patients that are inpatients and such. But we can still do more tests. It just slows down the turnaround time of getting the results.
Thank you. And we do know that with Test Iowa, they are at the brick and mortar facility now at North Park Mall, and the hours have changed a little bit, which may change the number of tests that are able to be completed each day. However, it is still available 5 days a week. Doug, we'll have you follow up on this one as well. How many ICU beds does Genesis have left? We are hearing only 9 left in the ICU.
Well, that's, you know, that's really not the way you look at it. And the number of ICU beds fluctuates hour by hour and shift by shift because patients are transferred in, they're transferred out, and some of those are surgical recovery. But we maintain and staff about 20 of our 26 beds on a routine basis. We can flex up to that 26 number, but we have to discontinue doing certain things to do that. And our plans, our surge plans allow us to flex up to the 36 number if we need to. Right now, what I would mention is we're able to transfer out non-COVID ICU patients. Let's say that they're a trauma or a surgical case that would require the ICU to the University of Iowa and on our Illinois side to OSF if needed. So, you know, on any given day, we may have a few beds, you know, we may have 5 beds or 1 bed or 2 beds. But for the most part, the last few weeks, our ICU has been running full.
And just to clarify that last question that's typed in there, is there a trigger point when you would have to send someone to some of those regional hospitals, as you mentioned?
Well, every single patient is evaluated based on the care that they need and whether they can be transferred even, or whether we need to care for them at the facility. So some people that come into the emergency department need a medical bed, and there we make adjustments. And that's the surge we're seeing right now, is in medical patients, not patients that need the ICU care. And if we're out of ICU beds at that point in time, you know, we look and see whether we can transfer that patient to Bob, and Bob does the same thing with us, or we look and see whether that patient needs to go outside of the region, or in many cases, if we know we're going to have a transfer out of the ICU, we'll hold that patient within the emergency department or within our recovery area until that bed becomes available. We really are not, on a percentage basis, the number of transfers we're doing right now is very small compared to the total number of patients that we care for. And in fact, if we look at it, we've taken 21 transfers in the last week from facilities surrounding us. We're much more of a regional receiving center than we are a center that transfers out. The only thing we have a tendency to transfer out are these ICU cases when our ICU gets full.
Thank you both. I was going to provide you each a minute if you'd like to provide any closing statements or information. We can start with you, Bob, if you'd like to add anything at the end here.
Just going to say we're all working collaboratively together, and it's really we're an incident command, so it's like emergency management. We're day to day, hour to hour. We're looking at our capabilities, and what we can do together as a community in terms of transfer to higher level of care or receiving transfers. But we look at everything from the staffing to the bed availability. As Doug said, it's not really the beds. I mean, we can surge up, and we are surging up ICU beds. It's a matter of being able to staff them. And if you don't have the staff for them, then it looks at your elective procedures in terms of tamping them down so you can pull staff to help as we go. So that's our biggest concern going forward, is with these numbers of tests in the community that are positive, we know a percentage of those patients are going to come to the hospital. One key factor with COVID that we know in terms of ICU capacity is they tend to stay, especially on a ventilator, for a longer period of time in our ICUs. And so it's resource intensive, and it becomes a game of numbers of, you've got a pretty full ICU, and more patients are going to be coming through the emergency room or are scheduled for heart surgery and might need an ICU bed. So we really do look at it all hands on deck each and every day to make sure that we can work together to take care of the community. This surge that we're seeing now, I kind of anticipated that's what it might look like in the spring. And fortunately, everybody did the right thing, and we didn't get to that peak. I'm worried now this peak is going to continue to grow. The good news, we're better prepared for it in terms of things like PPE, understanding the treatment protocols, having the lines of communication open up with all of our partners and in healthcare, so we can work to manage it together. The difficult side is this has been an 8 or 9 month journey, as Doug said. We've got staff that are tired. We've got staff that have seen a lot of suffering. And this is real. I mean, this isn't overplayed. This isn't for political purposes. This is a real pandemic. And with it, there are real people impacted and affected. And so we want to work together toward the common good to make sure that we can take great care of our community and that people's quality of life remains high, and that the people you know and love, your family, is not impacted by this. With the numbers going the way they're going, everybody's going to know somebody who's had significant impact from this disease. So there is hope on the horizon, we think, in terms of vaccine development and things like that, but this is going to be with us for a while. And so again, I'll go back to my original point. We need to find a way to coexist with it responsibly and with a passion for each other as our neighbor and our friends, that we have got each other's back, and we will get through this together. So I'm with Doug. I ask you to do the right thing. I ask our community for our help. And I promise we'll be there right with you to get through it together. So thank you.
Thank you. Doug, any final thoughts for you today?
I would just echo the collaboration point that Bob made. We've never had such close collaboration with the health systems in the region, with the University of Iowa, with OSF, as we have right now. We are constantly comparing notes, learning from each other, and helping each other care for the community in the best way that we can possible. 3 weeks ago, we had an outdoor press conference that many of you were at, and we talked about a concern that we felt was coming. It is here. The numbers that we warned of are here right now. And what we're trying to do is decrease them versus having them get worse. So we need the community's cooperation and help right now. Help us by doing the right things, following the CDC guidelines, so that our caregivers who are in this for the long haul and trying to do the best they can in caring for the community don't get overwhelmed. And we're on the verge of that happening. What happens is, in order for us to be able to go to higher numbers, our surge plans are put in place and we have to reduce elective cases, whether it's by 25%, 50%, or 75% to redirect staff. And that's not what the community needs. The community needs all of our capability. So help us coexist with COVID, just like Bob said. The hope is out there. I think it'll be in the next month or so that we'll hear about safe vaccines that can be administered. And within the next couple of months, probably the administration of those vaccines will start to happen. And I would project that over the next 6 months, we're going to see widespread vaccination for those who are willing to take the vaccine. And we may even reach herd immunity within that time frame. But that's not the case right now. Right now, we need your help. And it is a really difficult time for us because we are seeing so much volume. So please help the hospitals and help our caregivers.
Thank you to both of our health systems for joining us today. And we hope this platform helps you to share some of these important messages about what our community needs to do. Thank you to our media partners for being here with us and sharing this important information. And we look forward to talking with you all again soon. Thank you. Have a good afternoon.